wanted posters in the post office.
Yeah, because how many people really pay attention to those? And you've considered the thousands upon thousands of hits that YouTube gets all the time. All right, Gwen, thanks so much. You know, the worst thing about puberty, of course, is acne. The pimples, the blackheads, all. But what if acne all of a sudden made a surprise visit to you again, this time as an adult? Joining me now with tips on how to combat adult acne is Angela Cyrus-Fowler. She's an esthetician with the Davis Cosmetic Plastic Surgery Group located in New Jersey. Welcome.
Thank you.
You know, I always thought that I hope that when I reached a certain age, acne would be out of my life. And so many people probably think so, true.
That is true.
But it's not just not something that happens in our puberty years. It happens as an adult?
Absolutely. It's more so I'm finding a lot of adults in the 30s, the 40 age group. According to the American Dermatology Association, the median has ranged from 20 to actually it's increased to like 26 years old.
Really? And is it men and women get it?
It's men and women, predominantly more women. 50% are women.
Oh, wow. Well, that's not fair.
Well, it is what it is.
It is what it is. Okay, let's talk about treatments that people can do at home to try and keep their skin clear and fresh like yours.
Oh,
all right.
you.
Let's talk about there's professional products you can get, right?
That is correct.
Well, tell us about that.
All right. You want to have like a regime, and in the professional products, for example, I have here with me today is an acne system, and it includes everything from the cleanser, instructional guides. You have your topical creams. Also with professional, you have your pads. A lot of men prefer something simple. So we have a pad combination with salicylic and glycolic combination.
Professional means that you have to go to an office like yours to buy this.
That is correct.
Okay, so let's talk about what you can buy over the counter if you just want to go to your local drugstore and set up your regime.
There are some great products over the counter.
Routine, I should say, right?
Okay, there are some great products. What I brought with me today, you have a topical benzoyl peroxide, Clearasil.
Clearasil still works?
Yes, it does.
Okay.
Benzoyl peroxide. And also you have the Cetaphil cleanser. It's gentle enough, but it's very, effective. And you have a salicylic wash over the counter that Neutrogena has a product out.
What can you do at home? Can you do like the people tell you do your own home facials or saunas, steam up the bathroom, put a hot washcloth to your face to open up the pores and then clean?
That is correct. A steaming, whether you have a facial sauna that you want to invest in, or you can basically steam over a pot of boiling water with a hot towel, obviously cut off the fire.
Right.
But with the steaming of the skin, it does loosen up the sebum. It opens up the clogged pores, if you will. There are a lot of great over-the-counter home microdermabrasion kits. The masks, which are also great for over-the-counter at home.
At some point, you have to decide that maybe this is a serious enough problem that you may need to see really serious medical help. So what type of I guess, what we call invasive treatments do you have?
That's when you would see a doctor, and the invasive treatments would be like a dermabrasion, a TCA chemical peel, which would be performed by the doctor.
What do you have here? What is this?
This is Xeno.
Okay.
And Xeno is a very popular medical handheld device. And what it does, it expedites the healing of how long the actual bacteria of the pimple lives.
All right.
So rather than the pimple living like maybe 2 weeks, it may stay only like 2 to 3 days.
So how do you use it? Say just, for example, you were just putting it to my face.
Actually, you want to zap the targeted area with the handheld metal pad, and you're going to zap the area 3 times a day, and there's like a timer, 2.5 minutes.
Right.
And actually, there's going to be heat delivered to that targeted area of 121 degrees.
And you would show a patient how to do it?
Absolutely. There is training with that product because it is a medical device.
Well, okay. Well, there you go. It's so amazing to think that, you know what, I always hoped when I got past 1920 that acne would be gone, but that's just not the case.
That is not the case.
Angela Cyrus-Fowler from Davis Cosmetic Plastic Surgery. I want to thank you so much for joining us.
Thank you for inviting me.
Have a good morning.
You too. Thank
St. Patrick's Day, by the way, is tomorrow, and our own Jill Horner is trying to learn a few Irish jigs just in time to celebrate, and she's with some people who obviously know how to do it well. Good morning, Jill.
Good morning, Greg. It's